Obstructive sleep apnea. Definition: obstructive sleep apnea is the most common type of sleep apnea and is caused by obstruction of the upper airways. It is characterized by repetitive pause in breathing during sleep. Despite the effort to breathe, and it usually associated with a reduction in blood oxygen saturation. This pause in breathing, called apneas, typically lasts 20 to 40 seconds.
Obstructive sleep apnea syndrome, or OSAS, is a sleep disorder involving recurrent episodes of cessation of breathing or decrease in airflow for 10 seconds or more while sleeping. People with OSAS may also experience hypopnea, which is described to be episodes wherein the breathing becomes abnormally slow and shallow. OSAS arises due to an obstruction of the airways. Obstructive sleep apnea syndrome can be caused by obesity, excessive relaxation of the throat muscles, or an abnormality in the structure of the airways. Obesity.
So continue. Application in medicine. Physical intervention. The most widely used current therapeutic intervention is positive airway pressure, whereby a breathing machine pumps and controls a stream of air through a mask worn over the nose, mouth, and both. The additional pressure will hold open the relaxed muscle. Neurostimulation. For patients who cannot use the continuous positive airway pressure device, the USA Food and Drug Administration in 2004 granted pre-market approval for upper airway stimulation system that sends respiration and delivers mild electrical stimulation to the hypoglossal nerve in order to increase the muscular tone at the back of the throat so it will not collapse over the airways. Medication. Evidence is insufficient to support the use of medication to treat obstructive sleep apnea. These include the use of fluoxetine, paroxetine, acetazolamine, and tryptophan among others.
I'm a sleep neurologist, board certified in both specialties. I'm Dr. Virginia Runco. I'm a Johns Hopkins behavioral sleep medicine specialist. So obstructive sleep apnea is actually the more common one. It's essentially where the airway collapses while you sleep, and even though you're trying to take a breath, you can't. The breath is held for 10 or more seconds, and then there may be a choking or gasping sound as they try to breathe again. And so that episode is an apneic episode. So that's an episode of sleep apnea. So there's this holding the breath and breathing again. And this can happen repeatedly throughout it.
So continue. Pros. Diagnosis of OSA is often based on the combination of patient history and tests. These tests rank in decreased order of cause complexity from lab attendant full polysomnographic study of sleep down to single channel home recording. Numerous treatment options are used in the obstructive sleep apnea. Avoiding alcohol and smoking is recommended, as avoiding medication to relax the central nervous system, for example, sedative and muscular relax. Weight loss is recommended in those who are overweight. Continuous positive airway pressure and mandibular oxygen device are often used. Common side of OSA include inexplaining daytime sleepiness, restless sleep, and low snoring, with periods of silence followed by gaps. Less common symptoms are morning headaches, insomnia, trouble concentrating, mood changes such as irritability, anxiety and depression, forgetfulness, increased heart rate and blood pressure, decreased sex drive, inexplained weight gain, increased urination and or nocturia. Disease. Without treatment, the sleep deprivation and lack of oxygen caused by sleep apnea increase health risks such as cardiovascular disease, high blood pressure, stroke, diabetes, clinical depression, weight gain, and obesity. The most serious consequence of the entry the OSA is the heart. Persons with sleep apnea have a 30% higher risk of the heart attack or death than those unaffected. In severity and prolonged case, increase the pulmonary pressure or transmitted to the right side of the heart. This can result in a severe form of the congestive heart failure.
Keep going.
Todd hadn't had a decent night's sleep in years.
Well, I knew I had a problem because my entire family couldn't sleep.
Loud snoring. Then he'd stop breathing.
And then I actually had snort that would kind of all of a sudden I'd wake up.
Obstructive sleep apnea can deprive you of sound sleep and make you tired during the day. It can also cause serious health issues.
You can't help but think that's going to have some kind of impact on your health down the road.
Usually we talk about cardiovascular disease as the major problem. If you have severe untreated sleep apnea, your risk of dying from heart attack and stroke is quite a bit higher than the normal population.
Sleep specialist Dr. Joseph Kaplan says obstructive sleep apnea may also aggravate diabetes and it may contribute to mental slowing and memory difficulties. Plus, the associated daytime sleepiness increases the likelihood of motor vehicle accidents from driving drowsy. So what do you do if you think you have it? A sleep study during which you go in for overnight monitoring can help your doctor confirm the diagnosis.
He said you actually stop breathing 70 times every hour.
No wonder Todd was always tired. You see, snoring happens when the back of your tongue and throat relax and restrict airflow. If you have obstructive sleep apnea, your throat relaxes to the point where it blocks breathing. A CPAP machine is a device you wear over your nose. It provides air pressure while you breathe, which keeps the back of your throat open. The device made a huge difference in Todd's life.
Because I know that the more
Thank you.